Hello, everyone, and welcome to today's webinar. My name is Trevor Smith-Miller. I am the Communications Manager for the Canadian Cancer Survivor Network. Thank you, everyone, for attending today. If you're new to our webinar series, let's talk a little bit about CCSN. We are an organization working with cancer patients and survivors to learn about the complexity of our health system, connect with others to plan action, and act on those plans to create better outcomes and healthy survivorship. Please visit our website and you'll find plenty of information like news and events and information, as well, of course, this webinar series. Now, this webinar is being recorded and will be available on YouTube, and a link will be provided by the email that you registered with. Now, we will add a quick Q&A session at the end, but if you would like, don't hesitate and just post your questions down in the chat function and we'll get them at the end of the talk. And now, without any further ado, we'd like to welcome back Dr. Rob Rutledge. He is a radiation oncologist in Halifax, Nova Scotia, specializing in breast, prostate, and pediatric cancers, and is an associate professor in the Faculty of Medicine at Dalhousie University. His passion is empowering people affected by cancer and has delivered hundreds of public talks and webinars, like the ones here at CCSN, along with over 60 retreats and day-long seminars to thousands of cancer survivors. Rob has received a Cancer Care Nova Scotia Award for Excellence in Patient Care, a Doctors Nova Scotia presented with him with an Health Promotion Award in recognition of his contribution to physician health and health promotion in cancer patients. Rob co-leads CancerPEP, a comprehensive 6-month daily patient empowerment program. And without further ado, we'd like to give it over to Rob for his talk, Anxiety and a Cancer Diagnosis.
Great. Thank you so much, Trevor, and welcome everybody, whether you're live or listening to afterwards. This is an extremely important talk because anxiety influences, I think, all of us, and you can have a profound influence on your health by kind of understanding anxiety and reframing it using the energy of anxiety. And there are practical things you can do to actually really make a difference in terms of how you feel and your physical mental health. So, and frankly, we're post-COVID, and there's I know 1/3 of the population is suffering significant anxiety right now. So it's up right now, and you put that into a cancer diagnosis, and things can flare. And so I want to provide practical solutions about what you can do to really make a difference in your, health and happiness ultimately in the long term. I am going to share my screen, and let's just go there. Trevor's going to keep on admitting folks as they come through. I'm suspecting you can see my screen now. So thanks to the Canadian Cancer Survivors Network. Super important you tap into these resources, folks. There's so many things you can do to empower yourself. And so one of them is to listen to these seminars and so on. So, all right. Take-home points. I hope at this end of the talk, you can feel better, that you can empower yourself. Starts with this idea that anxiety is normal. We humans are going to feel anxious. And so this is what I think is our life force energy. And you can actually make a difference in your health and happiness by doing something about it. So you can empower yourself. I think one of the main points is that we do have a precious amount of life force energy. We need to put that energy into things that we can't control and let go of the other things, right? And so if you're really focused on your relationships and what brings you a sense of fulfillment and peace, you focus there so much, typically speaking, the anxiety will be less. And we're not after perfect. That's the other takeaway, is that, we're not going to somehow come into some Zen state and be kind of perfectly calm all the time. It's just not, we humans don't do that. We're going to flare our anxieties. How do we ride those waves? How do we reframe that? How do we use that energy to empower ourselves? The other thing is coming out clearly from the scientific point of view is that if we're kind towards ourselves, we're more likely to be able to do the psychological transitions as opposed to resisting, I'm not doing this right. I'm anxious. I'm upset. I'm making things worse. You're kind of creating an energy there. Whereas if we're just saying, okay, this is what human beings do. This is people who get a cancer diagnosis go through these phases. And so I want you to kind of be able to relax more easily into that. So ultimately you can it's paradoxical. You let anxiety be, and you can actually improve your health and happiness. Trevor, I'm wondering if you can just silence out anybody who's making any extra noise. Thanks. Okay, so big picture is people who have a cancer diagnosis, and this is consistent, right? We're being consistent with this idea that you can work with your anxiety and fulfill these goals. So big picture, we want to maximize our chance of recovery, no cure or longevity, for instance. We want to be able to think more clearly, and ultimately, why do you want that? Because you want to be able to function better, do the things that you love to do, spend the time in a better state of mind. So that's the more meaningful life. And so therefore feel better emotionally, be able to connect more deeply with others. So ultimately it's about, physical recovery, but psychological recovery as well. And ultimately, I'm also believe this idea that you can reframe. You can say in any circumstance, you can say, I can learn from this. I can get stronger from this. I can become a better person from this. And so that becomes a spiritual perspective that allows you, no matter what circumstance you're in, to put yourself into the driver's seat in some sense. So what do I want to do here is kind of give you the background right from start to finish in terms of the 7 things you can do to improve. And it's not get perfect, improve kind of a sense of peace of mind. Also always put that within the context of what I call complete cancer care. They call that integrative oncology as well. So the understanding piece, I'm giving you a piece of, it's part of the pie, part of the bigger picture, right? That kind of marriage between medical system and empowering body, mind, and spirit, those levels. And so getting the best from the medical system is a whole other talk in some sense, but we can even use our anxiety to understand and to tap into the knowledge that the medical system provides. So it actually decreases your anxiety. So these things aren't separate from each other. It's a holographic picture in terms of you take care of yourself in one realm, it's going to spill over to all the other realms as well. So obviously then the physical piece, healing at the level of mind, nurturing a spiritual perspective, you can do those things together. And that does change the physiology, the soup in which cancer cells can grow. Okay, it's hard for me to kind of overemphasize this part, which is your attitude, your spiritual perspective. Because if you get that right, then the outward conditions can vary quite dramatically, and yet there can be this kind of sense of inward peace. So you always have the opportunity, no matter what physical state you're in, you always have the opportunity to view the world from that perspective, from a more peaceful, more positive, more caring, more loving perspective. And that's why I think it's important to what I call set your intention, understand how you want to be in this world. So, and you can think of it in lots of different ways. Think about like any scenario, anything. You finish the seminar, the next person you connect with, the next activity that you do, and that literally can be an ongoing process. So how do you want to be in this world, right? How do you want to, what's the best version of yourself? What do you hope for yourself, right? And why not manifest that? Why not be that light in your corner of the universe? You can influence the people around you, no matter what your external circumstances are. You always have that capacity to connect and to love people and do the things you love to do. And so I'm going to maybe I'll do it. I'll do it differently because I'm in Hawaii actually. But so I typically do it as a ritual first thing in the morning. I do a mindfulness meditation, usually with a heart rate variability monitor. I'm really kind of settling down my nervous system, my nervous system. And at the end of it, then I set my intention. And typically for me, it's like, can I be kind? Can I be helpful? Can I be effective? Can I bring my love into the world? So I'm really, in some sense, praying hard. Sometimes I use religious language, usually not. But I'm really setting that aspiration. Let that be how I, interact, how I think, and like that be the subconscious drives that kind of power my behavior. You can also do that going into a difficult situation, a family, major family conversation, or going into the medical system. Like, how do I want to be in that moment? How do I want to be, in the doctor's office? Clear thinking, advocating for myself, listening, understanding, getting the best possible care, right? So those are the attitudes, and it's often normal that we're going to feel anxious going into those circumstances. So with that, I'm going to ask you to actually join me in this, and we're just going to do like a 3-minute exercise together. So get yourself into that space. I want you to think of somebody in your life that you care for. I think that might be a good idea. So regardless of their external circumstances, and regardless of whether they're happy, healthy, and safe, you're saying this as an aspiration for them. So you're bringing that person's image to mind, and you're saying to yourself, you can close your eyes if you want or not, may you be happy, may you be healthy, may you be safe. And then say it as if it's true for them. You are happy, you are healthy, you are safe. So ultimately, at a spiritual perspective, that's kind of true. And then say it for yourself with heart. May I be happy. May I be healthy. May I be safe. And then repeat that as an affirmation. I am happy. I am healthy. I am safe. Very nice. There's a longer, so you can release that kind of sense of visualization now. There's also a Hawaiian tradition called Ho'oponopono. And in that circumstance, you kind of think of somebody that you might be a little bit of resentment, a little bit of conflict, there's something that's unresolved, and that you do want a more peaceful, more harmonious relationship. And so you say to them in your mind, you can also do this from heart level if you want to kind of repeat it with me. You say to them, I'm sorry. Please forgive me. Thank you. I love you. And then reflect that to yourself. So you're saying this now to yourself for whatever digressions you may feel in some sense. So you say to yourself, I'm sorry. Please forgive me. Thank you. I love you. Nice. And let that settle. Let that settle into your psyche. Okay. So on with the talk. So setting that intention is so important. Sets the intention for the day. You can do that at the morning. You can do that in the evening, allow you to sleep better. Definitely settles down anxiety when you come to a bigger perspective of, opportunity. I have opportunity now. Okay, so anxiety is normal. So I'm thinking about kind of generalized anxiety, and then I'm thinking about anxiety related to cancer. And there's lots of different things we can be anxious about. Uncertainty plus not enough information equals anxiety in some sense. And that really talks about the cancer diagnosis, right? So it's really that, that at the start, it's a lot trying to figure out all things, including elements of grief and loss. We are grieving the expectations of the future, right? So the more we kind of come living in the present, saying, this is what it's like right now, and kind of coming to a radical acceptance of that, that can also decrease the pain of that difference between the two. And then completion of treatment. You would also probably know that at the end of chemotherapy, for instance, and you're heading back into your life again, back to the new normal, as they say, that could also be a difficult time. So those are anxious times. Any transition really can cause anxiety. You know that when there's, when things are happening, even though you think you might be in control of what things are happening, if things are changing, it's going to bring up those feelings of anxiety. Again, normal survival advantage. Fear plus uncertainty leads to anxiety. So, the negative outcomes can make things, the possibilities of that can make things more anxious. Okay, so I'm also going to kind of overlap with fear of cancer recurrence. So it's the fear, worry, or concern relating about the cancer coming back or worsening if you have cancer and it worsening. So again, the range is from mild to severe. I'm going to get that in a different slide. It can happen any time and really can dominate a person's perspective. Like the things dominate thoughts, the emotions that are with those thoughts, and our actions. And so we really want to be clear about acting with integrity and love despite that. Okay, so anxiety therefore produces a spectrum. And really, I'm asking you to kind of take the meta consciousness or the witness consciousness of your life to see, well, to what degree is anxiety actually causing me to not function well, not to be able to appreciate my life. I'm not saying feel better, I'm saying not to be able to appreciate the good things in your life. So how is it affecting your life? Right? So anxiety, is it stopping you from connecting with your loved ones? Is it stopping you from doing the activities that, fill your heart? So that's really, that's the flip point for me. And especially, I think, part of the medical system is getting the advice and counseling and support from, for instance, the counselors or psychologists, social workers. So sometimes if you have that kind of consciousness, oh, this has been too much, then I really do encourage you to reach out to others. So it's a quote that I read here. So fear of recurrence or anxiety, it's like a whale that moves into your living room. Over time, the whale gets smaller, but never quite goes away completely. A tenant you can't quite get rid of. Maybe it gets down to the size of a magazine rack. Once in a while, you bump into it, and sometimes it swells up in your face again, like when you go for scans, right? I like this description because the whale here doesn't go away completely. That's the norm. To think you're going to get your anxiety to go away, disappear, poof, and never come back, I think it's an unrealistic expectation, and you're better off understanding that that's with you. That's your life force energy. We don't have to change the truth. We just have to be able to work with it. We're kind of ride the waves type thing. Fear of cancer recurrence. I'm not going to read everything, but to me, it's like it really pervades most aspects of a person's life. And especially if it gets worse, then you're thinking, stopping you from activities, daily recurrence loss, lasting too long, impact on an individual's daily life, right? That's the cut point for me. Can you live with the whale in the living room? I think or how do we do that, I guess, is the way to go at it. So it's common, right? We humans are wired for this. So most people are going to have this at some point, moderate to high levels, and at least half of us, right? And then higher if you're in a more vulnerable population. And there's the 7% I'm really thinking about today. Like, if this is stopping you from doing something, and I want you to be able to work with this. And, it is work as well. This is not like listen to this seminar. Sometimes you can actually flip in a moment and have the aha moment and kind of release it and go on. But typically it's work. You're working with those emotions. You're watching it. You're watching the pattern. You're learning what works, what doesn't work, and so on. And so if you're disabled by it, be able to do the work, go see that counselor, go see somebody who can actually help you. It's the number one unmet need for certain, right? So because it's a harder thing to deal with, it's unmet need. And I'm thinking about, in the old days, when I first learned about this stuff 20 plus years ago, it was like 1 in 3 people who've had a cancer diagnosis are going to suffer significant anxiety, depression at some point in their journey. It's probably higher now, right? And so we could just relate and then also have compassion for everybody else that's going through the same thing together. All right. Risk factors, lots of different risk factors. Your perception, if you feel that you can't actually do something about it, if you need the kind of pat on the back, yes, maybe women report it more. We don't know. Younger age, definitely. If you're having physical symptoms or your quality of life is affected, then it kind of gets associated with cancer and anxiety and so on. Less education because you can't understand this and work with this. And then really this sense of isolation. And a lot of people do suffer from kind of loneliness. So again, just tell you the truth, and you can kind of just look at your life and say, well, what can I influence? How can I, connect more with others? And so then I also think about in terms of anxiety or fear of recurrence, like what's the trigger? What's the trigger point? And sometimes it's just the thought, oh, my cancer could come back. So that could be that the moment, like, oh, and then a little bit of spiral, and then watching that behavior. Take the mindfulness approach, watch the whole thing shoot out. You don't have to buy into it. Side effects, obviously, if you're suffering somehow or unexplained symptoms, right? Super tired, achy pain, something like that. And then you're starting to think about what are the possibilities that can trigger that. Anniversary of your diagnosis or some major treatment could be it. The medical system, like it's normal. Like I wouldn't expect you, like you might be like all to say that you're expected to have anxiety going into the medical system, right? Those medical appointments, the unknowns, the tests, getting the results. Those are all the flares, the normal flares that are going to happen. I don't think the flares are going to go away. So just allow that to be. And then if you hear a story about somebody who's had a cancer diagnosis, getting diagnosed, dying of that cancer, of your cancer, that can also trigger us off as well. So again, normal. So as soon as you recognize your anxiety starting to flare out, the easier it is to settle, right? So that's part of it. It's like, okay, that's the circumstance. Okay, now it's time to settle. And I'll talk about how to do that. Scanxiety. So it's this anxiety leading up to a scan or appointment to discuss those results. It's a typical pattern, that week beforehand, you're like peeking up into it. You're going to go get your results. Hopefully they come back. Anxiety settles. Probably takes a few days even to settle. Some people have the pattern of being anxious for about a month beforehand, and then it really takes them a long time to kind of settle themselves down as well. So that's, another pattern. Watch the pattern. This is what you're working with. You're working with your own psyche, with your own body. Just that's okay. That's the truth. That's the starting point for you. The point is that you can actually help yourself. Anxiety interventions can work, right? So they're studying more and more these techniques that can decrease the fear and anxiety at different stages. So cognitive reframing, we'll touch on this one a little bit, this idea that you're working with the thoughts, and especially when the core beliefs are abnormal. Mindfulness-based stress techniques, acceptance and commitment training, I think is excellent. We're going to talk about that one a little bit. This is idea of being able to watch. The watcher, the observer, is actually in a very peaceful state, even though the personality, the body may be in an anxious state. So you can actually be at peace in the midst of turbulence. And I want to touch around that one as well. And I love acceptance and commitments because you don't get rid of those anxious thoughts. You just kind of let them, set them aside, just let them be there, and then go ahead and live your life fully. And I think that's really the mature perspective. I think that's, and probably the most effective perspective too, as opposed to trying to get there. I also think if you can do that deeper work, looking at your fears directly, and especially living through, staying with the anxious feelings and moments and not trying to distract yourself. It's very important just to be able to, go through the complete wave, the complete pattern of the anxiety. And it takes a lot of the power out of it. If you can just stay, watch, you get better at it. And the peaceful part of yourself that's watching this can then start to, override the anxious stuff. So I think it's very important just to stay with it and learn from it. And then therefore to explore it. And ultimately, if you become comfortable with your own death, then you really gain a lot of power in the circumstance, right? So that's, if you have that inclination, I would encourage you, and especially, seeing a professional at the same time. So I want to make sure there's an overlap with medical care, right? Because the uncertainty is actually driving some of the anxiety. And so if you can understand and empower yourself and become an expert, learn what you need to know, learn what you can't know, one of those, learn what you don't know. So you can ask your doctor, so what are the chances of my cancer coming back, or when would I expect the cancer to come back would be the other way to go at it. So that's the when or if part of this. How would it come back? Like, what are the symptoms? What are the pattern? So that's something else. And again, I'm pushing you towards the, go into the dark stuff. And if you can watch it, see it, it takes the power away. Is there anything I can do to reduce the risk? Well, you're actually listening to a seminar right now that actually is going to overlap with exactly that question, right, for your situation. And then ultimately, I want you to come to that point of, okay, I've maxed out on understanding the medical perspective. I maxed out in terms of what I can do to empower myself, body, mind, and spirits. Now I can just let it go. I can't control the outcome, which is true for all of us. And you just kind of let that go, and you can kind of come to much more positive perspective. Okay, so then therefore, understand the signs of recurrence, because the point is, if you understand what you're looking for, then all the other stuff you can stop worrying about, the stuff that's not related to the cancer, right? So you get the flu, you get diarrhea, you get arthritic type pains. That's not cancer for you, right? And so you don't have to associate feeling crappy for some other reason, like a virus, with recurrence of cancer. So instead, you're asking, what kind of pain? It's a cancer pain would be a constant, progressive, severe pain. That's more of a cancer perspective, as opposed to flaring up and down like arthritis often does, or a growing lump on the skin, like for instance, a skin cancer scenario, really debilitating fatigue. You can't do anything, like you're wiped out, you're sleeping, 15 hours a day. So those deeper symptoms that can really, twig you to something bad happening. Okay, I'm gonna open up the window again. Now the garbage truck is gone. So, hand model of the brain. Because through evolution, there's the wrist, which is the spinal cord, and then the most basic part of our anatomy is the reptilian brain, represented by the base of the thumb. And then the next level is the what I call the irritable brain, or the limbic type of system. This is the approach system as well, that kind of thumb. And then overriding that is the most recent part of our evolutionary history, which is the frontal lobe. You want to live out of your frontal lobe because that's the positive, best version of yourself. And what happens is we engage our frontal lobes like this, and that's, you're thinking clearly, you're planning, your positive emotions, et cetera, and then something perturbs us and we kind of flip our lid and we disengage from our frontal lobe, and the irritable stress brain takes over, and, the reptilian fight or flight brain is engaged, and we're like, and this is the kind of anxious feeling. And then somehow we're trying to work towards re-engaging our frontal lobes again so that we can think, well, okay, I feel anxious now, but at least I'm thinking clearly and I can watch myself. I'm not so, what they call, fused into the thoughts of anxiety and kind of being so stressed and upset that's all I'm seeing. That's all I'm feeling. It's like you're kind of stuck with there. Coming back home, be more peaceful through connecting with your frontal lobes again. And I'm trying to get you, because we flip back and forth all day long, right? So that's norm. I want you to be here more often, and be able to recognize when you're here, how to get yourself back into a deep, clear thinking state of mind. Okay, so we're flipping back and forth between the two sides. And so I think about it as two conditions. So sometimes we're anxious, sometimes we're less anxious. How do we set up the conditions in which we're less anxious more often? And then that skill of coming back home again. So creating conditions. Now this is, as the kind of science evolves around that, if you use your muscles, the only way that you can tap into the chemistry of the myokines, it's the chemicals that are in your muscles that get released into your bloodstream, only if you exercise, only if you contract the muscles. And if you contract the muscles, then you give yourself like a polypharmacy of these very positive chemicals. And one of the first chemicals that goes right to your brain and takes down the anxiety a notch. Boom, just like that. So as soon as you kind of get into that first 2 or 3 minutes, the anxiety levels go down by itself. In fact, lactic acid, which you remember is like if you work super hard and you can't get enough oxygen in your muscle, lactic acid by itself goes up to your brain and actually makes you feel less anxious, which is, I think, incredible. But it's a really kind of cool physiology. So you need to exercise. Okay, next thing, in fact, I'd ask you to do that right now. I'm going to do that with you. Stand up even just for a moment and like stretch. Don't look at the computer screen. Don't look at the video. Anti-hunching. Up, 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 up. Ah. And so what we say, and there's a whole science around this, around sedentarism. You're standing up 5 minutes on the hour. And there's a whole bunch of data around this idea that we kind of get more fixated in the very close space if we're sitting for too long. So you don't want to sit for more than a couple hours at a time. So between watching a movie and answering your emails, definitely going to stretch and get up. Okay, so diet can also influence how the brain chemistry works. And one of the things we want is what they call low glycemic diet, meaning the sugar levels don't spike and come down. You want a nice, smooth, like I just ate my oatmeal to give me that kind of nice range of glucose. The sugar in your blood is super important. And then there are the brain foods, including blueberries. I'm thinking about that right now. The omega-3s, healthy fats, like the avocados. Another one that I could spend some time on is something called time-restricted eating, which is actually really good for your brain and recovery and thinking more clearly and so on, which is essentially not eating for many hours during the night. So from it's usually 10 to 14 hours minimum that you kind of you're finishing off at 8 p.m. but you don't then eat until 8 a.m. That would be 12 hours of a time restricted eating. So that's eating the same things but just not eating at night. Super important as well. Sleeping, napping, again, a whole science around this foundational activity of allowing your brain to heal itself, both physically and psychologically. And interesting, you kind of do your self psychotherapy through the REM cycle, through the dreams, et cetera, et cetera. It takes the kind of emotional bite out of it. So again, less anxiety if you're facilitating a better night's sleep. Practicing a relaxation technique. I think it builds a lot of things, including attention, compassion, and also kind of settles down. It's like when you're practicing meditation, the frontal lobe is actually quite engaged, and that frontal lobe overrides, or what they call dampens down the limbic system, the anxious nervous you, right? So you practice that, and then that permeates through the day. You're actually changing the neurophysiology, the neurocircuitry of your brain when you actually are in that state more often. It's permeating your day then, right? This kind of override, dampening, settling down the monkey there. Do the things that nourish your soul, right? Big picture is you fill your heart, you focus your energy on the things that are most important, like your relationships, for instance, getting into nature. The physiology of touch, oxytocin, really important. Even if you live by yourself, there are ways to take a shower, take a bath, give yourself a hug. Even give yourself a hug right now. Be kind to yourself. It's funny that by itself, it's like you're being nurtured as if like an infant. I'm sorry, but it's your physiology, it's your brain. It's actually having an influence on settling down your anxiety. Look for more hugs, I guess, is the other way, if you can manifest that in your life. And then honestly, we're trying to stay away from winding ourselves up. And for me, I don't like to watch television news. I find it too distressing. I'm too sensitive in some sense. So I listen to radio news every 3 days or so just to make sure I'm in touch with what's happening in the world. But oftentimes it's not necessary to watch the television news or the horror films, et cetera, et cetera. So the unnecessarily upsetting activities, like let go of that stuff. It's not good for you. It's, why not live a more peaceful life? Too much social media, especially the scrolling, like looking at all these people having fun, the best versions of their lives, not good for your psyche, right? So then there's this kind of comparison that happens. If you're using social media to connect one-to-one with another person, I think it's a very good tool. Obviously, we're trying to stay away from the habits, including cannabis. I'm kind of an anti-drug person because I think you have the capacity within yourself to kind of settle down your anxiety. So I believe mindfulness is key. Watching the patterns, it's like being a detective to your own life. Like what's happening, what worked before, what's likely to work next time. In fact, planning what you're going to do the next time you get anxious. So you're having those strategies, but you need the mindfulness to have the kind of the data, the truth, in order to settle this down. Okay, so the next thing I want to talk about is this idea of understanding when we do flare. I'm upset, scared, angry, flustered, stressed. How do you recognize? So the idea of recognizing it, watching it, learning from it. So there are physical symptoms that can be the cue to say, uh-oh, I've got myself really worked up here. So typically it's the scare thing. So pounding heart, breathing gets stuck, headache, neck ache, acid stomach, can't digest, jitter, sweaty palms, muscle-y stuff. The physical stuff, the adrenaline that's coming through could be the cue for you. It could be an emotional cue, right? For like seeing red anger, just feeling anxious, that feeling of anxiety, wanting to cry, dissociating can also be the cue to say, oh, I've got myself wound up here. It can be how you change, not what you think, but how you think, right? Most people, when they're frustrated, upset, they can't think clearly, like this foggy. You lose the bigger perspective, the planning perspective. And also you get very narrow and fixated, like almost like you're in a loop on that side, or fast manic thinking. It can be what you think in terms of like the actual senses that come out. So for me, if I'm swearing in my mind, I know that I've got myself wound up. Or the pointing of the fingers, that person, like you're labeling them or calling yourself names, saying, making the judgments. It's like, and that's the opposite of being in the more kind of open space of being able to respond in the way that you want to respond, right? So any of these things can be the cue to say, oh, I got myself wound up. So then what do? Have a plan, have a technique, practice this beforehand. I like this, and I want you to kind of do this with, well, actually, just at this slide, I think if you can't talk yourself down, we're going to do the breathing technique, or pretend that you're relaxed, slumping down, looking down, maybe chewing, for instance. And then another thing is, remember what it likes to feel good again. Like if you have a big presentation, oh, I really like it. Like 2 hours later, when the presentation's done and I'm gone home and things are good again. It's like remembering that kind of feeling, right? Talk to somebody, and I always say, find at least one person in your life who can just listen. Might even preface the conversation with, I want you to just listen. I don't want you to offer advice. I just need to tell you what I'm feeling, right? So you're setting them up to tell them what you want from them. Be more explicit there. Okay, you guys, I want you to do this with me, and maybe even stand up. It might be easier to do this. Also, I'm trying to get you just to stand up a little bit more. So if you're watching this, whatever mechanism, so you've lost it, and then you've recognized it somehow. Okay, my anxiety is really flared. What do I do? Okay, so the first thing is press the pause button, right? And so it's almost like the meta consciousness comes in because you're pressing pause button. You're not adding to it, exacerbating this. The thoughts are driving the anxiety. So the first thing is you want to just let go of the thoughts. You go back and make a decision. You're going to tap into all that knowledge, but just for the moment, just let go of all the possibilities, all the perseverations. Just say, okay, time out for you guys. I'll use you in a second. All right. Firstly, I want you to do this with me. Become very curious of the sensations that are in your body right now. What does that feel like? Be curious. Watch. What does your head feel like? Your throat feel like? Your heart feel like? Your gut feel like? Your pelvis feel like? Muscles feel like? Very curious. As soon as you're there, actually, you're engaging your frontal lobe and the insula. Continue to use that kind of mindfulness, interoception. You put your hands on your lower abdomen. 4 slow, smooth breaths. Watch. Be curious. What does that feel like? Now do a long, slow, smooth out breath. Out breath much longer. When you do the out breath, you're sending a message from your vagal nerve, which is on your diaphragm, all the way up to your brain to say, I'm safe, I'm okay. So then lastly, you can reassure yourself. I can handle this. Let's take one step at a time. I've been through difficult situations before. I have the resilience to do what's best in the circumstance. Right. Okay. So that's the technique. It's what I call the 4-breath technique, but it really does take mindfulness. And then you're engaging the wise wisdom part of your brain as well. Okay. I would say it's very important to practice a relaxation technique, something in which you're recognizing that the chattering mind is happening. You bring your attention back into something focused, and then chattering mind happens. You bring yourself back into present moment, the here and now. Chattering mind happens, bring your attention back. And it's that bringing your attention back, and then you're creating the neurocircuitry of peace, of calm, coming back home again. And so you can tap into that more easily on the day-to-day is the takeaway. And that starts to permeate your life. You can actually hold a more mindful, more peaceful state of mind as everything is happening, right? You practice this, you get better at this with time. So really, that's one of the 7 ways that you really improve your anxiety, is by practicing meditation. You're resetting the nervous system to be the less stress. The stressometer is reset to a lower level. And on cue, you can tap in and let your stress level come back home again. Okay. Fantastic book called Unwinding Anxiety. Judd Brewer is a addiction psychiatrist, but he's really become like a world expert in anxiety. And what I learned from his, well, oftentimes anxiety is driven by habit loops, which is really wild. Like, we have habits that make our lives more efficient. You know, the trigger, I get up in the morning, the cue, the cue, the trigger, I'm hungry, I want some coffee, I make the coffee makes me feel better. So cue, behavior, result, right? And so anxiety can also be driven in the same kind of systems. They're made for efficiency, but I want to just share some of his anxiety loops, that worrying is actually can be a loop as well. So you have the stressful thought, the cancer couldn't come back. And so sometimes we will distract ourselves. Oh, well, I'll just, go watch a movie, or I'll do some social media, or I'll, drink, have a drink of beer, or eat some extra pizza. You have the distracting thought, distracting emotion. You're feeling angry, flustered, lonely. And so you distract yourself, and that feels better. But this distraction has, those activities by themselves can take you away from what's most important. And actually they can be bad for your health too. For instance, you're overeating or over drinking. So, but the point is, we're not then there working with the anxiety itself, the source of the anxiety. And so we lost that opportunity. And typically anxiety worsens if it's a distraction that we use every time we're feeling anxious. So that's the plea for you again, to stay with your anxious feelings. So anxiety can happen. So you have the stressful thought, you get anxiety, and that can kind of shut you down. And then you avoid, I'm not going to go to my doctor's appointment. And therefore you're not actually dealing with the situation, and anxiety can get worse and worse and worse. So that's an exaggerated perspective. Lastly, I'm going to give you the example. The one at the bottom of the page is the idea that you have an anxious feeling, and then you start worrying, and then worrying makes you feel better in some way. It makes you feel better because you feel like you're actually doing something when in fact you're not doing anything. And the great example around that one is, let's say you're the parent of a 17-year-old, and you've given them the car for the evening so they can go to a movie and out to a little snack with their friends afterwards. And then, you send them out the door, and you start worrying about all the bad things that can go wrong to them. And frankly, your worrying doesn't change their risk, right? And so you're just distracting, and you're making yourself feel more anxious and worse, perseverating over all the bad things that could happen to them. So typically worrying provokes more anxiety. So it becomes a vicious cycle. So for people who worry a lot, it's one of those I want you to kind of think about how you might work with it in a different way and kind of focusing your energy away from that. Okay, so the problem with anxiety is that you can't simply just override it with willpower. So as much as I'm telling you, try to stay in your frontal lobe, our frontal lobes go offline often enough, right? We get tired, we get hungry, the stressor can get overwhelming and we're going to flip, right? So that's the norm there. And so again, the mindfulness piece is being able to watch the pattern and then map out the loop. When this happens and the loop of behavior and reward and the loops that are happening. And so the number one thing is to understand how your psyche works in terms of those loops itself. And ultimately you want a reward that's a better reward. You know, you want to spend your life doing the things you love to do or become curious. Curiosity by itself feels really good to the brain. And so if you can see it as an opportunity to learn and to grow and to be curious, when the anxiety flares, you watch that pattern, you get really curious, and you don't have to distract yourself, you don't have to worry, you get a better reward of the curiosity and the feeling and the learning feeling, right? And then you also can put your energy into things that are most important for you. Okay, so that's a bigger perspective around just staying with whatever happens. We can work with our thoughts as well. So the self-talk, here's a few ones. This is unlikely to be cancer. So you get anxious, get some arthritic pains, or I saw the doctor recently and I got a clean bill of health. There are lots of people like me who are cancer survivors that are doing well, and I'm like almost certainly one of them, et cetera, et cetera. So you can kind of talk to yourself. This is a bigger perspective. I think I'm going to go through this quickly because it's probably a whole other talk by itself. But it's the idea that the thoughts often influence how I feel. So if I think I'm a worthless person, I'm no good, that often leads to depression. Whereas we could reframe the truth is we all have inherent beauty and strength and so on. And so if you can understand that, believe that truth, you're less likely to get depressed and stay depressed. You're more likely to come out of depression when you recognize your inherent beauty and strength. So some cognitive distortion. So when we get anxious, upset, flustered, stressed, we often think in kind of, it's going to be a bad day. It's like 100% bad, the whole thing. And so we overgeneralize. If I stub my toe first thing in the morning, therefore it is going to be a bad day, and a never-ending pattern of, I can't get out of this. Focusing on the negative, focusing on the negative, not and minimizing the positive. Again, it's this whole kind of perception of how we are in the world, as opposed to just being in a more open state. Jumping to conclusions. If I say this, that person is going to say that, it's just going to go downhill. So it's like mind reading, fortune telling. Emotional reasoning is I'm anxious, therefore something bad has to be happening, as opposed to saying, well, anxiety is happening. It doesn't reflect necessarily on whether the cancer is coming back, for instance. The should statements is kind of you've created these kind of beliefs based on cultural norms. People should act this way. I should be this way. The medical system should be this way. And that creates a kind of a narrowness, fixedness, or whatever. Labeling that guy's an idiot, that doctor's an idiot, it means they're an idiot 100% of the time, 100% idiot type things, or I'm a loser, I'm always a loser. So it's all these ways that we talk to ourselves. Personalizations, or it's kind of essentially the me story, or blaming yourself or others. So this is the work of David Byrne. And I just gave you that example of emotions leading to depression, for instance, and the cognitive distortions. And the point is, you can change your mind, you can change your perception, change the game so that you can win. Is that really the takeaway, right? How you see yourself, others, and ultimately you can feel better, both emotionally and in some sense through productivity. And it's a 3-step model. And again, I'm just going to come through this quickly. So situation is external. And then we project onto the situation something that's going to make things worse, our negative perception of the situation. If you can see that, you can work through step 2 and ultimately go into step 3, which is the kind and rational response. When you're back into your frontal lobe, you can think more clearly and make a better decision and reassure yourself and be kind to self and others. So this person who is in the midst of chemotherapy is tired and emotionally frail, and nothing to judge that, that's just the truth. And then they have on top of that the thought, it's no use, I don't have the strength to get through this. And if they can see that they're creating a label onto a situation, then they can work onto the second part of it. The emotions are this kind of despair, shuts down the body in terms of energy. It's not helpful. And it's exaggerated because it's actually not true. It is a use. You are going through chemotherapy. You're actually improving your chances of being cured of cancer. And in this situation, this person does have the strength to get through it. And then ultimately, we want to be able to reframe, which is acknowledging the difficult thoughts, like this is hard, and then seeing a bigger perspective and then encouraging yourself, right? And one of the ways to say that, who says you always have to be strong? Sometimes to cry and fall apart is the best thing to do. Then I find inner peace and strength.
It's okay.
Yeah. So I wanted to give you that example of the way to be able to understand that our thoughts often influence our thinking. And then if we can use that kind of bigger perspective, a more kind perspective, looking at possibility, you can actually get yourself into a space where I can take that next step. I can learn from this. Can also just be the frame by itself. I'm just going to buzz through these just so that we can get on to the end of the talk here. So I'll put you back to this idea of looking at what scares you most. And this might be a difficult slide for some people to think about. Oftentimes people think about dying or death and the suffering prior to, or maybe even the afterlife. So it's a delicate topic. I think it's probably done best with professional. We think about being a burden or loss of dependence, or independence, I should say. And then kind of the sadness of that kind of separation. So I kind of put you on this idea is because if you can stay with that, if you can think about that, if you can understand that this human life is limited, no matter, how long you live, there's a limit to that. It's as if that understanding can then empower your life in this moment to recognize that life is very precious, and that we want to spend our life energy in the way that's most important to us. So there's that flip side of looking at the darkness, looking at the difficult stuff, to bring that into the present moment and the energy of the present moment. I also just want to kind of point you to this idea of when we're feeling emotionally distressed, we can judge yourself. And it's what I call the second arrow, poisoning ourselves. Like you get hit by an arrow and then you pull the arrow out and you stab yourself once more. That's the kind of unnecessary extra. So we judge ourselves for having those difficult emotions. When we fight against the reality, you're always going to lose if you're fighting against reality. It should not be this way. Life should not be this way. People should not act this way. It's inevitable that you're going to cause yourself some more distress as opposed to say, well, this is what's happening. This is the truth. This is my starting point, and I work from there. So, and then just being able to hold yourself and say, okay, that's where I'm at. I'm feeling this right now. I can work with this right now. I'll work forward. I'll learn from this. I'll get stronger from this. And we let go of judgment of how it should be different than it is. Now that's the extra, that's the second arrow. It's the poisoning of ourselves, of the frustration of saying this should be different. Let go of it. Come back home just to this moment. You have so much more energy in this moment just to say, this is what it is right now, and to be able to work from there. So then you ask yourself, what's your relationship? Another way to say that, you could say that stress is toxic. Oh, we should stay away from this. When you're anxious, you think, my life is toxic. This is too much. I'm not doing it right. I'm inadequate. It's like, it's this kind of struggle and judgment of your own anxiety, right? It shouldn't be this way is the biggest perspective. But if you can just accept, well, this is the truth, this is the thoughts, the emotions, this is what's happening. And you can even reframe that to say, okay, well, I'm getting a signal. Something important is at stake here. I can learn from this. Here's an opportunity to grow. What's the next step for me? It's like a different state of mind than trying to say it shouldn't be, right? And the metaphor I like from the acceptance and commitment training is, if those difficult thoughts and emotions are your hands and they're in your face all the time, you can barely see out through your fingers to all the things that you need to do and that you love to do, and it's part of life and makes you effective and connects you with other people, and like it's the work that you need to do in the world. It's really hard to focus on that work when you're covered up here. Instead, we can set our hands down so our hands don't go away. We still have hands, but we set them down, and we can see the world and connect with the world and make better decisions within the world, right? To be able to accept that that's the anxiety thoughts and so on. So slowly cover hands. I just basically did this for you. We feel disconnected. It's easier to take action and to see things clearly when we just say, okay, well, there's my anxiety, and set that aside. Okay, so now what's really happening here? Okay, diffusion. So the idea is that we get stuck in our thoughts. Our thoughts are the ones that hook us, and we get kind of stuck in this, as opposed to a bigger awareness of not knowing, lots of potentiality, seeing that. Right? So I can't cope. I'm just, so if you have the thought, I can't cope, you would say, I'm just having the thought that I can't cope, right? So it just like adds a degree of separation to the can't cope. Or I'm noticing that I'm having a thought that I can't cope. So again, you're distancing yourself there. Thank you, mind, for that thought. It's like, okay, that thought came up. Well, thank you for suggesting that, but I'm actually going to focus my energy here now, right? So there's all these different techniques. The thought balloon, you can just put the thought I can't cope in a balloon. The balloon can still be there, can just like float away. Leaves in the stream meditation, you can see that the thought I can't cope is just like a leaf in the stream that kind of floats by, and you can let go. It's a famous meditation, actually. Okay, this is the old story. I remember this story that I tell to myself about I can't cope story. Right. So again, you're gaining a perspective on this idea that the thoughts are just coming up and they're just thoughts. We don't have to, even if the thought is true, you don't have to kind of agree with it or, put energy into it or focus in it or follow that pathway. You can just say, well, okay, well, there's the story of that old thought. Aha, there it is, that I can't cope story. So like, it's just like, you're just adding some levity to the circumstance. Okay, essentially I'm finished the talk there, but I want to just a quick pitch. We have a cancer patient empowerment program called CancerPEP that folks can sign up for. We're going to open it up quite shortly. Again, we're in the midst of a phase 2 trial. It's myself and my wife, who's a psychology professor. We put this together. Comprehensive, every day for 6 months. We email you to tell you the ways that you can empower yourself. So it's the physical training, strength training, or yoga by videos, dietary advice, including weekly videos, talk about time-restricted eating, different relaxation techniques, plus or minus, biofeedback, the sleep science, how to form these habits, stress reduction, relationships teaching. It is very comprehensive, and every day you get this 3 to 5 minute video telling you what you need to do for that day and kind of teaching and encouraging you. So it's a really fun program. We can set you up with 2 other co-participants. You can join us for a monthly Zoom video conference. You can visit us at CancerPEP.org. It's a super program. We got tremendous feedback, done it with the prostate cancer guys and publishing and so on. So I think that's it. You can go to the website, CancerPEP.org. On that website is a 10-minute video, explains the program. You can sign up there as well. So I think that's it. Take home messages. Difficult thoughts and feelings are normal. Don't need to struggle with them. We can choose to live a values-based life. So despite the fact that thoughts and anxieties are there, we can still live fully. And that by being kind to yourself is the best way to make those changes. I think that's it. So
Excellent. Thank you so much, Rob, once again for such a great talk.
Thank you.
We will open the floor to questions, but I was wondering, Rob, I do remember last time when we opened this floor up to questions, you wanted us to stop the recording. So I was wondering if that was the case this time.
Whatever works for everybody. It makes sense to kind of maintain confidentiality to stop the Q&A or not, or people can jump in right now and say, I'm willing to have my question recorded.
Absolutely. Well, I will actually, I'll just wrap up the talk right now for the recording, but please put your comments and questions in the chat and Rob will answer them. Just a couple of housekeeping things before we stop the recording. Thank you once again to Rob for his fantastic presentation. Always a pleasure to have him on. And I do believe, if I'm not mistaken, we'll have you on later on this year as well, correct?
I think so. September, we'll try to tackle another difficult topic.
Absolutely. All right. Well, this is just one in a series of information on our webinar series. This one and our other webinar series, Financial Survivor to Cancer Survivor, Cancer Survivor to Financial Survivor, sorry. If you're not seeing emails for either of those in your inbox, we do use a third-party email service, so check your spam folder. Sometimes the service or Google unsubscribes, so just make sure that if you aren't seeing our emails, just head on over to our website. There's a big banner up that will give you all the information you need to resubscribe to our emails. And while you're at the website, you can check out our webinar. You can find all of the webinars on demand, and you can also find a whole bunch of different information about news and events and whatnot. So thank you once again to Rob, and we will stop the recording so that we can field questions here in the chat. So thank you.